Hi, my name is Cassandra. I'm the program administrator for the Nutrition Metabolism program. This is Dr. Dini, our assistant program director. Dr. Moore is our director. She couldn't be here today. So thank you for joining our webinar. We're going to go through a slideshow, give some information about the program. You're going to hear from two of our previous master's students who are now in our PhD program here. Hear about their experience, and then we're going to open it up to some questions from you guys. So we will begin. All right, so Dr. Dini, take it away.
Thanks very much, Cassandra. So let's see, who do we have here? How can I see who we have? You're right there.
Yeah.
Oh, Maria, Abby, Eric, and Kim, J. Kim. Okay, and hopefully we'll have more. In any case.
There's a chat window at the bottom that you can open up. I'm not sure if you guys noticed that, but you can type your questions in and we'll get to those at the end. So we're not answering questions already in the slideshow. So type your questions as they come up.
Exactly.
Yeah, do you want to minimize?
And yeah, I want to do that.
Just right there.
Go ahead.
Oh, that is hard. Okay. Why is my mouse? Okay. Whoops. Okay. We'll just. Sorry.
Oh,
having some
this is.
technical trouble.
Oh no, they have to read. Okay.
Yeah. All right.
Oh, perfect. Okay, thanks very much for everyone to join us. And as Cassandra said, I'm the Associate Director, and Dr. Moore is at a meeting, American Heart Association, along with some students and postdocs from the program. So right away, you can see that the students here go places. Where is that meeting?
Arizona.
Arizona, they go to Arizona. Okay, and our program, interdisciplinary training in nutrition metabolism. And that means that you have training in basic research, clinical research, translational, and epidemiological research. And the faculty are from departments of medicine, biochemistry, pathology, physiology, and others. Multifaceted faculty here to provide support for you. This one, thanks. So some of the characteristics of the program. Well, we are a small size, small classes, seminars, and work groups, right? Small size means you don't get lost in the crowd, which is a great thing for any student to believe in. Students with varied backgrounds who have a wide range of interests and career goals. That's what we offer. That's who we try to recruit. And this is helping you in your education as they contribute to the learning experience. And we all learn from each other. Multidisciplinary nature of training, basic science, clinical, and epidemiologic, as we've discussed. And collaborative learning environment. Personal connections that you'll make here at the med school. And this, the advantage to our program is that we are at a med school. We're BU Medical and Dental, both here at BU Medical Center, where we have lots of seminars and teaching by guest lecturers who are clinicians and researchers. Sorry, I just pushed the wrong button.
Oh, it's okay.
Okay.
Were you ready to go to
Yeah.
the next one? I'm getting some background noise too. Could you guys mute yourselves if you're just listening in to the presentation, please? If you want to unmute at the end to ask questions, as well as typing them in the chat box, you can do that then. Sorry.
Okay, so students in our program have varying interests, and they include basic clinical, epidemiological, dentistry, medicine, veterinary medicine, okay? Our recent graduates have gone to dental school, medical school, osteopathic medicine, PhD programs, right? Working in research labs, academics, and industry. So our students go places, right? And we love what we do, and that is to help you get to where you're going. Current classes the current class this year is made up of about 14 students, 5 males, 8 females in the first year. We have 21 that are continuing students doing research. Some of these are full-time, some of these have jobs and are part-time. And the countries of origin are US, Canada, China, Cyprus, Mexico, Indonesia, Kazakhstan, Pakistan. So this is a program that you're going to meet people. Okay. The requirements for the degree. There are 32 credits required for this degree. 28 are course credits, 12 of which are electives, right? 4 credits are research credits. Research-based thesis, okay, is a must in our program. This is not a library thesis, but it is a research thesis, and that can be an epidemiological project, a clinical research project, or a basic science project that's done at the bench. And in the end, there's a thesis that is written and presented publicly, orally, and defended, and we are there to help celebrate your accomplishments. Now, as you can see from this picture on the right, this is our class from just last year's graduating class. We have 3 students in PhD programs, 3 students in dental programs, 2 that are pursuing medicine, 1 in osteopathic, and 1 who's in pharma and planning to continue her studies later. The 2 arrows are pointing to the 2 students that you're going to meet today, or hear from someone today. To the left is Ioana, and to the right is Yuhan. And to the right of those 2 is our fearless leader, Dr. Moore. Core classes are listed here. We have fall and spring classes. The nutrition, biochemical, and physiological basis of nutrition is a 2-part class. 1 in the fall, 1 in the spring. There's also research design and statistical methods for biomedical sciences. Clinical nutrition and nutrition seminar, where the students give seminars and they learn how to address public crowds and public speaking. As you can see, it's something that I don't do. But anyway, you're going to be well trained in doing it. And in addition, if you are lacking maybe in some biochemistry background, then that would be a good elective to take and probably a requirement in the program. Sample electives, okay, we already said biochemistry may be one, but there are lots of them. And there are a lot that are honed to different interests. So those that are interested in dental school may take evidence-based dentistry, and they may take head and neck anatomy, whereas others may take cancer biology and genetics, neurosciences, all these, physiology. They're all geared and here to fulfill your interest and help you attain your goals. You can finish this program. This program is kind of a program that you can do in a variable amount of time, as little as 1 year and as long as 2 years, or maybe even a little longer. The sample program completion here is listed for 1 year and 2 years. So for a 1-year degree, I'm not going to go into this too much, but for a 1-year degree, you will start in September and finish in the next September, okay? And you'll be able to walk in that graduation in the previous May. And that is a kind of a hard road to hoe there. So that's a lot of work in a little bit of time. 2 years, okay, is a good way of taking advantage of all the opportunities that we have here in terms of research and collaborating with the faculty. That would be taking classes in your first year, fall and spring, maybe getting into a lab or during the summer to learn the techniques, and then have a full year of research over the next fall and spring semesters. This is an excellent way of becoming the best scientist that you can be, the best professional that you can be, but certainly you can do it in 1 year, and that's not to say you won't be any less well educated, right? It's just whether your timing will permit you to go for 2 years or not. The Nutrition and Metabolism Master Program requires a research-based written thesis. As we said, this is research mentored by one of our distinguished faculty and is based on basic clinical, translational, or epidemiological research. And this is presented, defended in a public seminar, as we just, to celebrate your accomplishments, as we just said. And so some of our basic science labs are throughout the medical center. We have labs that are in biochemistry, pathology, and laboratory medicine, biophysics, vascular institute, cardiovascular medicine, and in endocrinology, my lab. And these take into, study research, study things like adipocyte biology and prenatal programming of brain development, atherosclerosis, vascular biology, insulin secretion. Clinical and epidemiological labs are also here for your for you to study with. We have a variety of people that are interested, that work in these fields in endocrinology: Carolina Povian, Dr. Nawfal Isfan, Dr. Michael Hollick, Nicole Spartano, and Dr. Moore is here in the Department of Medicine, Preventive Medicine, and Epidemiology. And these groups study various things, clinical research in terms of vitamin D and bone metabolism, weight loss, and exercise and physical activity throughout impact on health. And Dr. Moore is the supreme epidemiologist here at BU and in our program. Thesis from recent graduates. Here's a whole list of basic science theses that we could go through, but I don't think we're going to do that. But it's just to know that we have students that have done well in various scientific approaches to research in various labs studying adipogenesis, periodontal disease, atherosclerosis, insulin secretion. And we'll hear from one of those students. And again, on the clinical and epidemiological side, we have the association of physical inactivity with periodontal disease, eat your vegetables and cardiovascular disease, adherence to a Mediterranean-style diet, and you'll hear that from Ioana, and diagnosis of a non-alcoholic fatty liver disease in obese adolescents. Admission requirements. Well, this is important for you guys. So completion of a standard pre-med science classes, okay? 2 semesters of organic chemistry and biology. Biochemistry is preferred. So these are the classes that we would expect applicants to have. Prior research experience in the form of courses are a plus, but not mandatory. We can train you in the research that you need to do. International students must provide TOEFL results or an equivalent. And to apply, BUMC, you go to this website and click on Apply Now. And that is BUMC, BU, EDU, GMS, Nutrition and Metabolism Admissions. Online admissions applications. Okay, so official transcripts of all schools attended are required. Official test results of the GRE, MCAT, or DAT is also required. Your resume or CV, 3 letters of recommendation from faculty who know you well, especially those with whom you have worked in a research setting or laboratory. A research and teaching faculty are preferred in terms of those letters of letter of recommendation. Written personnel statements that describe your qualifications, objectives for the program, experience, interest in research, why studying nutrition and metabolism, what is your motivation? This is what should come through in your written personal statement. And no single portion of the application is more than important than any other. So it's you are a complete package. Your application is a complete package, and we look at that complete package. Admissions decisions are made on a rolling basis for both the spring and fall. Okay, early applications are encouraged. There's information for tuition and fees that it's on our website. The financial aid office is available to discuss financial support, and a number of provost scholarships are awarded each year to help students in their financial needs. So that is the program that, in a nutshell, I think it's a great program. I think it's great because our faculty love what they do, and they love training students to become the best that they can be and to help them achieve their goals. And I think we're going to hear from the experiences of two graduate students that we had those arrows pointing to you, Ioana and Yuhan, and the first one up is going to be Ioana.
Hello, everybody. So I'm Ioana. I'm a registered dietitian and a graduate of the Nutrition and Metabolism Master Program. And I'm a first-year PhD student here at BU in the biomedical science with concentration in nutrition and metabolism. So I chose to enroll in the master's program because of the strong reputation and cross-training that the program provides in both basic science and nutritional epidemiology. So I took a couple of electives through my first year, such as physiology, and also I took the molecular nutrition, which is required for all the master's program, for all the master's students, and that helped me to generate hypotheses in the nutritional epidemiological studies that I wanted to focus on. And I also added classes in statistical programming language such as SAS to help me analyze data for my master thesis. So the combination of the scientific and epidemiological training helped me to lead my own independent projects in the second year of my master program. So I joined the Epidemiology and Preventive Medicine Lab at GMS here at BU with Dr. Lynn Moore. So first I did a literature review of the topic that I was interested in. And then I wrote a scientific proposal that was approved by the Framingham Study Executive Committee. And I had to do that because I wanted to analyze data in the Framingham Study. So you need to do the proposal first. After I got the data, I used the SAS, as I said before, a statistical programming language to analyze the data. I wrote the thesis, I submitted my thesis, and I'm currently writing the manuscript. So more specifically about my project, so the hypothesis is to examine the association between Mediterranean diet and cancer risk, and we included obesity-related and breast cancer in particular. So after I got access to the Framingham data, we observed people from 1991 up to 2013 to observe whether they developed cancer or not. I got access to data and variables that we thought we will use in our models, such as age, smoking. So Framingham cohort study has a lot of data, not just cancer, but cardiovascular, any like cognitive function, a lot of disease outcomes that you might be interested to analyze. So particularly for my thesis project, I got access to the data that I needed for my Mediterranean diet project. I excluded people that already had cancer, and then I followed them over time to see whether they developed cancer or not, and how is this associated with Mediterranean diet. So the first result is presented to you in this graph here. So on the y-axis, we have the risk of total cancer. And on the x-axis, we have overall men and women across the three different categories of Mediterranean diet adherence. And what we see is that I found that women with higher Mediterranean diet had lower total cancer risk compared to women with lower Mediterranean diet. And you can see that with if you compare the light blue with the dark blue bar in the women. And at the bottom, I included all the variables that I included in the model to control for them. So, and then for breast cancer, again, we see the inverse association with Mediterranean diet and breast cancer. So the first 3 bars is a total breast cancer. The second, we stratified by menopausal status, and the third by breast cancer subtypes. And again, it's consistent that Mediterranean diet is inversely associated with any type of breast cancer that we looked. And now I'm gonna pass to Yuhan to talk about her master thesis.
Hi everyone, I'm Yuhan, and so I'm going to talk about my experience in the in this master program. And so the reason why I chose nutrition and metabolism master program in the beginning, a little bit background by myself. I have an undergrad major in biological science, and I know that I want to do cancer research, but at that time point, I have a limited amount of full-time research experience. So that's why I chose this program in the beginning. And through this program, I think some of the most important thing for me is, as an international student, I come from China. I was really bad at public presentation, and the class that this program has really enhanced and the public presentation skills of mine, and the basic science class really broadened the scientific knowledge of mine. And also there are a lot of acquired skills and experience that I learned during the research project I'm going to talk about later. And a few things I do love about this nutrition metabolism program is, first, it's a small class size. I think at our year, we have a class of 7 or 8. So it's like we become really close friends. This is really important for me since I'm away from my home and all my old friends, and the directors and other faculty members are always there for you if you have any sort of questions, doubts, and they're always there to help you guide through the whole processing. And also there are various directions for us to conduct a full-time research. There are a lot of labs that are willing to take a master's student if you are interested. So a little bit about my thesis project. So the aim is to determine the effect of a putative acyl-CoA synthetase 5 inhibitor on lipid accumulation and glucose-induced insulin secretion from pancreatic beta cells. A little bit of background. So the chronic excess nutrients can lead to glucolipotoxicity of beta cell in type 2 diabetes patient, and characterized by increased basal insulin secretion and decreased GSIS. I'm going to show you a graph later. Basal hyperinsulinemia can contribute to the development of insulin resistance, and with blunted glucose-stimulated insulin release can lead to elevated blood glucose level. Reducing the level of the lipid inside the cells may reverse this kind of adverse effect. Here is 2 graphs that shows what I just talked about. So on the left side, we can see there is the white little dots inside the cells, like they are the lipid that we dyed with and so, as we can see, with the increased level of glucose in the media, we see more lipid accumulation inside the cell, and this kind of glucose increase also lead to, if we look at the right-hand side, we can see there is an increased insulin secretion with the gray line, and it actually was blunted when the glucose was high. So in order to solve or partially resolve this problem, we use this adipose, which is an ACS inhibitor. So ACS is an enzyme inside the cell that basically allow the fatty acid to be trapped inside the cell. So Without this, the fatty acid would not stay in the cell for a very long time. So if we inhibit this enzyme, we're thinking to inhibit the fatty acid from coming into the cell. And as a matter of fact, we did, and we see the enzyme activity was inhibited by this compound. And we see on the middle here, we see the fatty acid incorporation into cells are inhibited as well. And also on the right side, this panel actually shows like we have a decreased intracellular lipid level with this compound. Here we look at the calcium level, and this very colorful graphic, like every color represents one cell, and we recorded the calcium activity throughout the period of time. And we come up with the graph on the right-hand side, and then we can see the calcium activities are different, and with the cells cultured with this inhibitor. Finally, we move to the insulin. So the major function of beta cells was to secrete insulin. And we can see with on the left side is insulin content, which means how many insulin the cell has. So when culturing with a higher concentration of the compound, we see the cell accumulates more insulin. And on the right side, it's an insulin secretion, meaning like the insulin gets secreted out of the beta cell. And we can see also the compound increase this part of the insulin secretion. So our conclusion is that this compound are beneficial because it can reduce the intracellular lipid accumulation and it normalize the calcium activity, increase the insulin content and GSIS. So this is what I have. And shall we take questions?
That's fantastic. Now I just want to say that you just heard from two of our stars. And they're stars, and we know they're stars. And in fact, BU recognized that they're stars, and they accept them into the PhD program. And one is a star in epidemiological studies, and one is a star in basic science studies, and wants to go on and do cancer research. So, and we're just waiting for you to come here and become stars as well. So I think we'll ask you for any questions. And we'll all be here to help you answer.
Sorry, I'm just trying to bring up the chat.
Okay.
Okay. So we got a question from Jay Kim. It says, are classes conducted on BUMC campus? Yes.
I'm going to say yes, but you can also take classes at Tufts, for instance. Some people do that, and so. That's only, a 20-minute walk or a 10-minute bus ride. So there are possibilities of taking classes at other universities throughout Boston.
Yep. You can take classes at Tufts University Medical School as well as Harvard Medical School. We're part of a consortium with those two other medical schools in the Boston area. We also do have some classes that you can take as electives on Boston University's Charles River campus, which is the main undergrad campus. The Sargent College of Health and Rehabilitation Sciences has a few classes that students take as electives sometimes, but yes, for the most part, classes are here on BMC campus in the South End.
Do we see other questions, or is that?
That's the only question we've gotten so far.
Okay.
Do you want to address some of our frequently asked questions?
Okay, well, let's see. All right, I'll take this one. If you don't have biochemistry, will you have to take biochemistry? Yes, you will have to take biochemistry. It's a one-semester class, but it's important for background for most of the stuff that we do. Do you need to contact a professor about research before applying for admission? No. Okay, so our program is here. You come in and you get established, you take classes, you learn from these classes, and maybe these classes influence what you may be interested in doing. And it's an evolution of your thought process that will lead you to a professor. And we will guide you in that. Is part-time study an option? Yes, it is. People do that. Some people are doing it as they work
Full-time.
full-time.
Classes
Yep.
part-time.
Some of them are working here at BU and taking classes through tuition remission, and some are taking classes and working in industry. And can you talk with current students? Well, yes, you can talk to these two that we just listened to anytime. I'm sure they'll take your questions. But yeah, contact us and we'll put you in touch with students that you, depending on what you need to do. What GRE scores are acceptable? That's what someone is asking. And you know, hey, I say send them in, right? do not apply because you think your GRE scores are low, right?
Yeah.
Do not do that. We are looking at an entire package, right? And so that's only one aspect of your application. And in fact, we, yeah, I'm not, so I won't comment on a number, okay? Our classes conducted, okay, no, that's where I answered. I was going backwards.
One of the other frequently asked questions is about English proficiency tests. We take the TOEFL or the online equivalent, the IELTS. I know that right now with some of the coronavirus stuff going on and issues with China, that some testing centers are having limited access. So I believe that the entire graduate medical sciences are accepting Duolingo English language proficiency tests for Chinese applicants if that is necessary.
I wanted to ask about the GRE requirement. Yeah, I'm interested in pursuing dental studies and took the debt. Yes, send it in.
Yep.
We're okay with that.
Yep, you can submit the GRE, the MCAT, or the DAT. We know that people take other tests depending on if they're planning to go into dental school, med school. J. Kim asked, have students pursued careers in industry instead of academics such as PhD or MD? And
Yes.
how often have they pursued RD, registered dietitian license?
Yes, we have some that are registered dietitians that have already have that registration as they come in. And some are interested in taking those, right? And acquiring that. And I would say pharma, yeah, we have one student from this class that we were looking at in that picture who is working at pharma now. Novartis. She will probably pursue other things in the future, but you know, you are trained here to go into pharma because you will have, if that's your interest, basic science, you will have an experience that will put you in a position that you can work anywhere, I think.
Mm-hmm.
And that's what we do. We put you in a position to succeed.
Yeah, you can really tailor the program to your area of interest very well, but there's a lot of variety to things you can do with it. Okay. J. Kim says, awesome, thank you so much. Any other questions or shall we wrap it up? And you're always welcome to email me.
And visit, and come and visit. That was the last picture, right? We hardly even said that. But come and visit us at BU, talk to Dr. Moore, talk to me, talk to our students. You know, hey, Boston's a great place, right? It's great, lots of activity, lots of pharma, lots of universities. Yeah, this is a great next step.
Yep. So if you have any other questions or if you're interested in scheduling a time to come visit campus and meet with some current students, your best bet is to email me. My email address is down at the bottom there. You can find my phone number as well on our nutrition website. Yeah, any of us can answer your emails.
And tell your friends.
Yeah. All right. Well, if we don't have any other questions, I think we're going to sign off. Thanks for joining us. Have a great afternoon.
Thank you very much.